Hello everyone, welcome to my channel Proud Nurse Prasanna. First of all, thank you so much to everyone who recently subscribed to my channel. Your support truly means a lot to me, and I also received many comments positively on my previous video, and really I'm grateful for all your love and support, guys. So without any further delay, let's get into our today's video. So today's video is about nursing courses after 10th and intermediate. If you have completed 10th or inter and want to build your career quickly, or if your goal is to get a government job, or if you are passionate about nursing and want to choose it as your career, then this video will definitely help you. After completing intermediate, many students get confused about whether to choose GNM, BSc Nursing or ANM. In this video, your confusion will be completely cleared, and I'll explain which course is best based on career growth, government job opportunities and future scope. Firstly, let's discuss the nursing courses available after SSC. So after 10th, one of the nursing courses available is ANM. ANM stands for Auxiliary Nurse Midwife. This is basically a diploma course, not a degree course. So after completing 10th, students can get admission into ANM colleges based on merit marks, I can say. This course mainly focuses on basic nursing care, maternal health, child health care, and community health services. ANM is especially best for students who are interested in community-based healthcare, working in villages, PHCs, and rural areas, and who want to serve for people in those communities. And the duration of the ANM course is 2 years. These 2 years, students will have theory classes, practical training, and clinical postings at PHCs, government hospitals, vaccination programs, etc. Now, coming to eligibility, who are eligible for this ANM? Students must definitely pass the 10th class. In some institutes and states, intermediate students are also eligible. And in Telangana, generally 10th pass qualification is enough for admission. Okay. And the age limit for ANM is usually between 17 to 35 years. 35 and moreover 40 is also now eligible. And let's talk about the subjects covered in the ANM. And the main subjects include community health nursing, child health nursing, midwifery, nutrition, and first aid, and health promotion, infection control, maternal health care. So next, what skills can develop through the ANM? So students can learn about injection administration, vaccination programs, health education, rural health programs. So these are the main skills which they can develop. Coming to fee structure, now ANM courses mainly in the government colleges. If you get in the admission in government colleges, so the fee structure is usually very affordable. Tuition fees may range from 5,000 to 20,000 per year. This is tuition fees, and additional expenses like exam fees, books, uniform, and hostel charges, etc. So these are additional again. So overall, the complete course may cost around 20,000 to 60,000 approximately. This is the calculation which I have done. And government colleges are a very good option, which I can say, for students from low income family backgrounds, like low budget backgrounds, etc. And private colleges, if you compare, in private colleges the fee structure is comparatively very higher. So tuition fees may range from 40,000 to 1,20,000 per year. Okay, so actually ANM is 2 years, right? So per year 40,000 to 1,20,000 they may charge. Extra charges like lab fees, books, uniforms, hostel facilities, they are added separately again. So total course fee in the private college go around 1 lakh to 3 lakhs depending on the college. Okay, now depending on the college facilities and their management, etc. So it may range from like 1 lakh to 5 lakhs, 3 lakhs. Okay, so this is the fee structure. And additional expenses, like apart from tuition fees, students like they may have to spend money on clinical materials, stationery, travel expenses, registration fees, examination fees. So this is all again extra, money, spending money, and scholarship opportunities they may have. Some students, they may get government scholarships and fee reimbursement, minorities scholarships, SC, ST, BC scholarships also they are eligible. So next, let's discuss nursing courses after intermediate. Once you complete intermediate, one of the most popular nursing courses is GNM. GNM stands for General Nursing and Midwifery. This is a diploma nursing course and is one of the best options for nursing students who want strong clinical knowledge and early job opportunities in the nursing field. The duration of GNM course is usually 3 years along with the internship training. During this course, students learn both theoretical subjects and practical clinical skills. And coming to eligibility, students should complete their intermediate, and in many colleges, science background students are preferred. And but what happens is some institutes may also allow other streams also. For example, from MPC, MEC, CEC backgrounds also, students are allowed into GNM course. And what are all the subjects involved in this GNM course? Anatomy and physiology, medical surgical nursing, child health nursing, mental health nursing, midwifery, community health nursing. And one of the biggest advantages in this GNM is clinical exposure. So students are highly involved in this clinical settings. Next, coming to the salary, in private hospitals for the GNM students, starting salary may range from 12,000 to 25,000. Around 12,000 to 25,000 they may for that amount they may recruit, and it depends on the hospital and the experience. And coming to government hospitals, salary packages are usually higher, okay, with additional benefits and increments also. And most important thing to remember is that GNM offers faster employment opportunities and strong practical knowledge also. However, compared to BSc nursing, promotion opportunities are abroad scope may be slightly limited in some countries. Okay, but still chances are there, for students who are looking for affordable nursing education with good opportunities in their job, GNM is considered as a very good option. Next, let's discuss about BSc nursing. This BSc nursing stands for Bachelor of Science in Nursing. It is a degree course and one of the most preferred nursing courses after intermediate, especially for students who are planning for government jobs, higher studies, or abroad opportunities. The duration of this BSc nursing is 4 years. During these 4 years, students learn both theoretical subjects and advanced practical clinical skills also. And coming to the main focus, advanced patient care, medical surgical nursing, critical care nursing, community health, research, and leadership skills they can have. Now coming to eligibility, students must complete intermediate with BPC stream. In most colleges, usually students should have minimum qualifying marks according to college or university rules. During BSc nursing, students study various subjects. Okay, anatomy, physiology, biochemistry, pharmacology, MSN, that is medical surgical nursing, CHN, child health nursing, mental health nursing, midwifery. So these are all the subjects which are included in the BSc nursing program. One of the biggest advantages of this BSc nursing is advanced clinical exposure. Students are exposed to advanced clinical settings like RICU, emergency intensive care units, cardiac intensive care units. So they are posted in such areas, so they can gain higher knowledge in ICU, PICU, emergency departments, community field settings. So they have multiple exposure, multiple exposure for different areas. Students for BSc nursing, after completion, what work they can do, like staff nurse, nursing officer, ICU nurse, OT nurse, emergency nurse, research nurse, or tutor, lecturer after higher studies. So now they can also work in government hospitals, private hospitals, medical colleges, military hospitals, abroad healthcare sectors, and so these are all some such a scope after BSc nursing. Okay, so these are all the areas, these are all the sectors after which nursing student can emerge into these areas. Now coming to salary, in private hospitals the starting salary may range between 18,000 to 30,000, 18,000 to 30,000 depending on hospital and experience. In government sector, salaries are, yes, as we know, usually they are higher, and along with allowances, and so good job security will be there. And one of the biggest advantages of this BSc nursing is better career growth, and promotion opportunities will be higher. And coming to excellent, they have excellent abroad scope compared to ANM and GNM. So most of the countries like UK and Germany, they are prefer mostly BSc nursing graduation students. Why? Because they are highly skilled comparatively to ANM or GNM. Why? Because they are posted in various sectors. They have research knowledge, administration knowledge, and they'll be having good communication skills. Okay, so that's the reason. And if your goal is government jobs or higher salary, or if you want to go to abroad, or you want to have better higher studies with a long-term career growth, then BSc nursing is considered as one of the best choices after intermediate. Coming to the main segment of the video, now let's discuss which course is better, which one is better to choose, either GNM, ANM, or BSc nursing. Which one is the best choice? Okay, this is completely my opinion, and I'm not saying you must follow only this path. It all depends on your interests, your talent, your career goals, and especially your financial background. Based on these factors, you can choose your course that is best for you. Okay, and so now if you want a quick job opportunity and want to start earning early, then ANM can be a good option because it is a shorter duration, and with a shorter duration with a affordable fees. Okay, and if you want strong clinical exposure with the practical hospital clinical experience and affordable nursing education, then GNM is a very good choice. Okay, now GNM students also, because they get good practical knowledge and can start working early in the hospitals. Okay, and what if your goal is like a government job, higher salary, better promotions, you want to continue your career growth. Okay, then BSc nursing is considered as the best option among all these courses. Okay, because BSc nursing is a degree course, and it offers more value compared to diploma courses like ANM and GNM. Many government recruitments and foreign countries also prefer degree qualified nurses, not diploma. Okay, so that's the major difference in between these three things. At the end of the day, there is no small or big course. What matters most is your hard work, skills, and dedication in the nursing profession. Okay, so choose your course wisely based on your financial situation, your career goals, your interests in nursing, and your future plans. And whichever course you choose, if you work hard consistently, you can definitely build a successful career in nursing. Yes guys, this is all about today's video. Hope you guys understood, and if you choose this video as helpful, please do share and don't forget to subscribe my channel. And thank you for watching guys. Bye bye, take care.